twist. My next guest argues that medicine should be more than just treating disease or broken bones. Dr. Allen Susssman is a retired endocrinologist and a clinical assistant professor at the University of Washington. He's also the author of a new book called Saving the Art of Medicine. Thank you for being here, Dr. Susssman. Welcome to New Day.
Thank you, Amity. Glad to be here.
So let's talk about your specific field of medicine. You were an endocrinologist. What does an endocrinologist do for anyone who might not understand?
Well, an endocrinologist is involved with hormones. The main one usually is diabetes and insulin.
Yeah.
Because that's where there are the most number of cases.
Right.
But it can be reproductive hormones. It can be the thyroid. So it involves different organs because hormones involve the whole body. Well, and
also the endocrine system involves a lot of people's personal lifestyles and choices. You're getting very personal with your patients, I would imagine.
That's why I went into it because I like dealing with patients. I like getting to know patients. I learn something. Hopefully, they learn something, and that's what makes it rewarding.
You actually had a wake-up call in terms of your holistic approach to medicine. How did that come about?
Well, you have to find the good from the bad, right?
Yeah.
And I had a very bad hand injury where I cut 8 tendons on my right hand.
Oh, gosh.
And and not only that, but I was a tennis player and piano player, and neither one of them worked out well over a year and a half of 3 different surgeries in terms of really being able to get back to the level I wanted to be.
Absolutely.
So I could say as I lost that, but then I gained something.
And what was that you gained?
And what I gained was that there were some friends I had who would always try to get me interested in doing meditation practice with them. And I said, don't have time, sorry.
Yeah.
Suddenly I had time.
Yeah.
And I started doing some meditation, learned more and more about it until it became an important part of my life, where after a while I was giving classes on meditation and having meditation groups as well.
That's impressive. It is hard. Meditation is not easy. It takes a lot of willpower, but it's also so good for your body and soul, right?
Right, and I like to, and people sometimes feel it's hard to do meditation. That, as you say, it's a difficult practice. And actually, what I say is everyone has meditated at some point.
Yeah.
Right. If you're watching a sunset by the ocean, if you're skiing down a hill, if you're just running, and you're just losing yourself at the moment. And that's the important thing about it.
Just being mindful. And mindfulness is so important when it comes to everything in our lives, and especially when it comes to meaningful doctor-patient connection. What does that look like to you?
Right, and that is the prime area of what medicine should be. There was a time when that's all there was to medicine. Was a doctor or a healthcare provider and a patient. But eventually, in the last 100 years, science has become very important, which is good. It is good, right? But you are losing something with it, or we need to rebalance. Is what I say is, we have to start considering more the interaction of people and human beings, and there's even evidence-based medicine even saying that that's important.
Okay, but it's not just with the I mean, there's so much to this, I feel like. The health insurance companies are a component, the companies who own medical practices. I mean, there's just so much demand, so little resource. How do we break this down to give doctors more ability to have those connections when they're so overworked?
Right. Big problem.
Yeah.
And I think the answer is individually.
Okay.
The institution is big. The institution is not going to change overnight or in a month or even a year. There can be little incremental changes that can be done, but that's the key. The key is the relationship of the people, of the doctor and the patient. As I'd like to sort of say with patients when I would discuss let's say high lipid levels, right? And I did a lot of research, and I can go through all the different studies with it.
Right.
And after 5 minutes, they're crossing their eyes, looking at me with all the information.
Yeah.
And I say what's important is that there will still be our relationship, and the information I'm giving can change.
Yeah. I know that the insurance companies, the companies who hold this, are trying to find ways to help doctors and nurses not face burnout, but it is a problem. What advice do you have for them and for the industry as a whole?
The advice is consider the human relationship as primary.
Okay.
And they scratch their heads a little bit, but I think they understand it too.
Yeah. Thank you so much for your help and you're talking and sharing this with us. And I think this is something that would be great to give to anyone in our family who might be a practitioner, or maybe just drop this off at your doctor's office and not say a word. I think it's great.
There you are.
Thank you so much, Dr. Susssman. That was wonderful.